tulikubaliana na Wakenya kwa uchaguzi uliopita ya kwamba hatutaki afya iwe ni starehe ya watu wenye wako na uwezo. Tunataka afya iwe ni haki ya kila Mkenya. Na ndio sababu hiyo tukasema ya kwamba tutabadilisha mfumo letu. We made a conscious decision as the people of Kenya that because of the Constitution, Section 43 of the Constitution of Kenya, it makes it mandatory for government, because health is not a privilege for those who can afford. It is a right for every citizen of the Republic of Kenya. It is also our commitment under the bottom-up economic transformation agenda that we are going to make it possible for those who do not have the means, those who do not have the income, those who do not have land, assets to sell so that they can get help, that even them, they will be beneficiaries of health at the highest standard possible. Na ndio sababu hiyo leo tumefika hapa. And let me say that when we unveiled the bottom-up economic transformation agenda, we declared universal health coverage as an irreversible commitment. We pledged that no Kenyan would ever again be forced to choose between buying essentials like food and others and seeking treatment, or lose a loved one because healthcare is beyond their reach. Immediately after assuming office, we initiated far-reaching reforms to overhaul our healthcare system and make universal health coverage a reality. In October 2023, I signed into law 4 landmark pieces of legislation that laid a new foundation for healthcare in Kenya. These reforms placed the old framework with the Social Health Authority to guarantee universal access, making primary health care free at the point of use, digitizing services delivery, and to fight corruption and wastage, and to secure sustainable financing for all our facilities. Today, I am pleased to affirm that SHA is turning the vision of universal health coverage into a living reality for many Kenyans. To date, more than 26 million Kenyans have registered with SHA, and already 5.5 million of our people have accessed essential healthcare services. These are not figures. These are not cold numbers. These are lives transformed, families reassured, and a nation steadily moving towards the constitutional promise that health is a right for every citizen. Despite the progress that we have made, I made this commitment that we're going to have a new contributory system that is going to give equity so that people contribute in accordance with their ability to contribute. And that every citizen will contribute to the extent of their ability. And that those who do not have the ability to pay, that the government of Kenya and friends are going to step in so that we can pay for those who do not have the means or the ability to pay. And that is why, ladies and gentlemen, we are gathered here today to launch the National Government Sponsorship Program and the Digital Sponsorship Program of SHA as a transformative, compassionate step to ensure that no Kenyan is left behind. Leo hapa tumekuja kwa sababu tulikubaliana ya kwamba tutabadilisha mfumo wa afya na kwamba kila Mkenya kwanza, kupitia kwa ile sheria tumepitisha ya PHC, kila Mkenya ajisajili kwa SHA. Kujisajili peke yake bila ya kulipa pesa yoyote. Kila Mkenya unapojisajili, basi utakuwa na nafasi ya kwenda hospitali ile tunaita primary health facilities kwa level 3, level 2 ya dispensary, level 3 ya health center, level 4 ya sub-county hospital na zingine county hospital. Na ukienda pale kama outpatient, uko na homa, uko na nini, uko na malaria, uko na nini, unaenda pale, unaonana na daktari, unadungwa sindano kama ni kudungwa sindano, unapatiwa dawa kama ni kupatiwa dawa, alafu unatoka hapo unaenda nyumbani bila ya kuulizwa pesa yoyote. Wacha nirudie, kwa sababu kufikia sasa bado tuko na mahospitali katika counties zetu ambazo wanaitisha wananchi pesa. And I want to again repeat, no Kenyan going for outpatient facility in any hospital, dispensary or health center should pay. That service is already paid for by the government of Kenya. It should be offered. Citizens must go to hospital, they must be treated, they must be given medicine, and they should go home without paying any penny because it has been paid for by the government of Kenya.